This short video will be covering a basic review of the structure and function of the foot, specifically in regards to its anatomy. I wanted to start with covering the functions of the foot and using this video of power walking to help highlight a few of those. The foot is the base for the body, and the foot is the reason, a lot of the reason for the stability that we're able to find in our day-to-day life. That's one of the main functions of the foot, is the base and the stability for the rest of our body. It allows us to propel through space as we move along. It allows for adaptation to uneven terrain. We can see in this video here as this person walks on some, sandy terrain. You'll notice that the foot allows for a lot of the adaptation that's going to occur here as it moves through its range of motion as this person walks along. You'll also notice as this person walks along the amount of shock absorption that happens. Now, in this person, a lot of the shock absorption happens as they hit their heel first. They go through our regular pattern of walking as they supinate, pronate, and then supinate again. This dynamic nature of the foot allows for shock absorption. Now, it doesn't have to occur like this. Oftentimes, as in running or sometimes in walking, people land more on the balls of their feet or what have you. But just realize the foot absorbs a lot of the shock away from our knees and our hips. And sometimes we even talk about the amount of force that the feet feel, and that's because of the amount of shock that they can take, those impulses from the body. Lastly, as this person walks along, you'll notice that the feet allow our body a lever so that we can accomplish more motion with less effort. Without the feet, it would without the lever, it would more energy and effort would be expended to create a simple motion such as walking. So let's go ahead and get down to the important joints of the foot and ankle. I wanted to start with the joints of the ankle. There's three basic joints which make up the ankle: the tibiofibular joint, the talocrural joint, and the subtalar joint. The one I wanted to hit first is this tibiofibular joint. It's the one that's often forgotten, which is why I wanted to just touch on it first. I think the reason it's often forgotten in comparison to the other two joints, it's the joint that allows for essentially no movement. Very, very little. You can see here 1 to 2 millimeters of spread. However, it is important, especially when we go through our dorsiflexion range of motion. Anyone who has gone through an injury to this joint, as Rob Gronkowski has here, or many other athletes, this injury is often, its common name is a high ankle sprain. Anyone who's gone through this injury, or anyone who has had to manage this injury, realizes that this joint is not inconsequential. This particular injury is hard to work through, it's hard to manage, and so it's a joint that's in the ankle that we shouldn't forget, and it's one that we should take into account as we evaluate an ankle. I wanted to use this video to highlight the other two joints so you can see them in isolation here.
By fitting into the mortise formed by the tibia and fibula. The mortise and tinion structure is well known to carpenters and craftsmen who use this joint in the construction of everything from furniture to large buildings. The arrangement is very stable. The two bones that make up the back part of the foot, sometimes referred to as the hind foot, are the talus and the calcaneus or heel bone. The talus is connected to the calcaneus at the subtalar joint. The ankle joint allows
This is also called the talocrural joint. That's probably the more correct name as opposed to the ankle joint here.
to bend up and down. The subtalar joint allows the foot to rock from side to side.
That side-to-side motion is also called pronation and supination, in case you have forgotten. That up and down motion happening at the talocrural joint is plantar flexion and dorsiflexion. So let's come back here. I wanted to make one important note about pronation and supination in regards to closed chain and open chain scenarios. if you go ahead and lift your foot up off of the ground and go ahead and supinate your foot or invert your foot, you will notice that most of the motion, well, a lot of the motion is happening in the hind foot. And you'll also notice that a lot of the motion is seen in the sole of the foot, where the sole of the foot is now pointing to the midline of the body. We can describe this here, supination in an open chain scenario. The calcaneus is inverting, the talus is adducting or moving to the midline of the body, and we're going into plantar flexion as we supinate. Now, I want you to contrast that. Go ahead and plant your feet firmly on the ground. Now I want you to supinate. Obviously, you're going to experience less motion in the closed chain scenario. Hopefully that's obvious. But I want you to also realize that you can still accomplish the motion of supination even without the extreme ranges of motion. But I do want you to notice some distinct differences. When we're in a closed chain environment and we supinate our foot, our calcaneus still inverts. We can demonstrate this here. Our calcaneus is still inverting. However, as opposed to the middle of our foot now pointing to the midline, something different is happening. Up in our ankle joint, our talus is now shifting differently than it did before. So the talus is now going to abduct. It moves away from the midline. And now we move more towards dorsiflexion. So in an open chain, we have this type of an environment with the calcaneus accomplishing a lot of the motion, the talus adducting, everything moves towards the midline of the body. But in the closed chain scenario, it changes. The talus moves away, we dorsiflex, but our calcaneus still moves in, so we look like this. Now, pronation is a similar type of thing. When we pronate in an open chain, again, everything's going to move together. We're going to end up with the sole of our foot pointing away from the midline of the body. We evert, we abduct, we move away, and we dorsiflex. Now go ahead and plant your feet firmly once again and pronate. Take that medial longitudinal arch of your foot down to the ground. You'll notice we're still going to evert at the calcaneus, but now the talus is moving towards that midline of the body, and we're going to plantar flex slightly. An important distinction, especially, I wanted to just bring that up here as an introduction. You know, when we get into gait, this distinction will become important when we talk about functionally flat feet versus structurally flat feet. So having a basic knowledge and understanding of this will prove important as we move forward. Just to drive this home even a little more, let's watch this video from Dr. Johnson and Dr. Mitchell.
In open chain pronation, the talus has to abduct, dorsiflex, and the calcaneus has to evert. In order to mimic that, in closed chain, the tibia internally rotates, taking the talus with it, but now we call it adduction of the talus, and plantar flexion. The calcaneus still does eversion. So here we have a real foot with open and closed chain pronation. This is open chain pronation. And now we're going to do closed chain pronation. My hand is around the talus so you can see that movement better.
So an important distinction when it comes to open and closed chain supination and pronation. Let's move down quickly. We'll hit this video again really quickly. We just covered the ankle joints. Just realize the foots have joints as well.
The hind foot is connected to a set of 5 tarsal bones that work together as a group. These bones are unique in the way they fit together. There are multiple joints between the tarsal bones. When the foot is twisted in one direction by the muscles of the foot and leg, these bones lock together and form a very rigid structure.
This is in a supination environment.
When they are twisted in the opposite direction,
as in pronation,
they become unlocked and allow the foot to conform to whatever surface the foot is contacting. The tarsal bones are connected to 5 long bones of the foot.
We'll stop that there. The thing I just wanted you to glean here is, although we often refer to the foot as one structural segment, just realize that it's not. It's made up of multiple bones which all can adapt and change independently of the others. It's made up of the 5 metatarsals, which again can adapt and change independently of the others. The shock absorption, the adaptation to uneven terrain, this function of the foot is accomplished mainly here in the forefoot, with all of these individual components working together. So they're not independent, but they work together to accomplish one purpose, but they still have the amount of movement they do because they are independent of each other. And that's what I would hit here in these mid-tarsal joints, just realizing that they can move, they can roll, and they play a pivotal role in accomplishing some of those functions of the feet. Next is the muscles of the feet. I really like this slide. This gives us the axes of the foot. So this is going to be our plantar flexion and dorsiflexion axis. This here is our supination and pronation axes. And then all of the tendons or the muscles, the ways in which they act about the foot. I think it's worthwhile to just review these and realize that, for example, when you contract the tibialis anterior, it's not simply going to accomplish a motion, but often it'll accomplish multiple motions in its action. The other thing about the muscles of the feet, because I think the amount of bony structure in the foot, we often forget the amount of musculature that occurs in the foot. So as I go through here, the 4 layers of the feet, go ahead and just review those muscles and just realize how important they are, that they really are, they assist in accomplishing the functions of the feet. A lot of these muscles are going to act at the toes. However, some of them are going to act across just those smaller joints in the midfoot. I'm going to just highlight this here. As we go through these movements, if you need to review these, you can. And then just some general ranges of motions. These are the textbook answers. And oftentimes on our written test, these are the answers that you will need to be able to reproduce. Variances outside of these textbook answers certainly happen. And not all of them always lead to pathology. Sometimes it's more range of motion or just slightly less. But these are the general textbook answers that we need to know in response to our general ranges of motion. Here's the nerves. I'm not going to take the time to review these here, but just realize that they're there. Hopefully you remember these from your 440. And then let's get to the ligaments. I wanted to just bring up this slide here as I've been talking, through this midfoot. Because of the amount of bony structure, look at all of the ligaments that need to exist to attach all these bones together. Now, we won't need to know all of these ligaments, but I wanted you to see them to realize any one of these ligaments can be injured, and sometimes they are in a sprain. I have personally treated several times where I thought one of these smaller ligaments were injured. But for the purposes of this class, we're going to just focus mainly on the lateral ligament complex and the medial ligament complex. I have another video here so that we can see these in isolation really quickly.
Both sides of the ankle joint help hold the bones together and stabilize the ankle. 3 ligaments make up the lateral ligament complex. These include the anterior talofibular ligament, the calcaneofibular ligament, and the posterior talofibular ligament. A group of ligaments, together called the deltoid ligament, support the medial side of the ankle. Ligaments are also important in connecting the distal tibia and distal fibula at the lower end of the leg where it forms the ankle mortise. This connection and the collection of ligaments that support it are called the ankle syndesmosis. 3 main ligaments form the syndesmosis. The anterior inferior tibiofibular ligament connects the tibia to the fibula and crosses above the front of the ankle. The posterior fibular ligaments connect the tibia and fibula behind the ankle joint. These ligaments include the posterior inferior tibiofibular ligament and the transverse ligament. The interosseous.
We'll go ahead and pause there. Those are the ligaments that I expect you to be able to know for class. I will go back here. This deltoid ligament, This lateral ligament complex, as we go here, I lost it. So these two, the anterior talofibular ligament, the calcaneofibular ligament, and the posterior, we'll play this for a second.
And the posterior talofibular.
The posterior talofibular ligament. So we have the deltoid on the medial side. We have this lateral ligament complex here. And then the last ones are simply these, the high ankle sprain ligaments, or these tibiofibular ligaments, this anterior inferior tibiofibular ligament, and the posterior inferior tibiofibular ligament, along with the transverse ligament. Those are the ligaments that I expect you to know for class, and that's a short review of those. Some bony landmarks that we will go through in our palpation for class. These are we will work through these so that we can make sure that we know these. You'll need to be able to palpate the navicular bone, the fifth metatarsal, the first metatarsal, the lateral and medial malleoli, as well as the talus, the head and the neck of the talus. Finally, I wanted to make a brief mention of the arches of the foot. There is 3 main arches in the feet. We have the medial longitudinal arch, the lateral longitudinal arch, and the transverse arch. Oftentimes, the medial longitudinal arch and the lateral longitudinal arch are just combined into one arch called the longitudinal arch. But just realize there are 3 individual arches that exist. These arches are important to accomplish the functions of the feet. And that's what I'll say about that for this moment. Oftentimes we forget that the arches are maintained by all of the structures in the feet. We often will talk about the bones, but the bones are not the only thing which maintain the arches of the feet. The bones are certainly an important component. However, our ligaments, our plantar fascia on the bottom of the feet are important in maintaining arch integrity, as well as the intrinsic and extrinsic muscles of the feet also contribute to arch integrity. And whenever we have a lack of arch integrity or a dysfunction of an arch, it can come from any one of these 3 components dysfunctioning or not working correctly. There are several more slides on the arches of the feet. If you would just take a moment and make sure to review those so you come to class prepared and with an understanding of the importance of those arches. That wraps up this video of the brief review of the anatomy and structure and function of the foot.